All right, I got this great question about thyroid. Can a carnivore diet help with thyroid, hypothyroidism, Hashimoto's in particular? Well, the short answer is it has. We've certainly seen a lot of people with their thyroid improving. They're either able to reduce or sometimes completely eliminate their thyroid medication. We very often see these thyroid antibodies, TPO and thyroid antiglobulin, actually come down. And there's actually, in fact, a recent study that actually shows this, at least in the context of a low-carb diet. So here this was published just a few months ago. It showed that people that had hypothyroidism that were treated with a low-carb diet actually saw a significant decrease in their thyroid antibodies, and they also saw decreased levels of inflammation and swelling in their thyroid as seen by MRI. So the shorter answer is yes, and there's some scientific evidence that would support that, and I've certainly seen that anecdotally many times now. Now, additionally, some of the things to consider or to think about is the fact that a lot of times we'll see a decrease, just in low-carb diets in general, and carnivore is no exception, a decrease in the amount of T3, or the active form of thyroid hormone. And while some people would say, well, that's obviously a problem, the reality is it's probably just a physiological normal response to a low-carb state, meaning you just need less thyroid hormone to get the job done. You are therefore increasingly thyroid sensitive. This is the concept that people understand when it comes to insulin sensitivity, but all hormones have a sensitivity range, and it goes the same for androgens, estrogens, thyroid, growth hormone. If there's a hormone or a signaling molecule, there is a receptor that has a variable level of sensitivity. So again, do I need more? Is it better to have lots and lots of hormone floating around because I'm really resistant, or is it better to have maybe less hormone because I'm more sensitive? And I think that is a debate worth having. Anyway, so yes, the short answer is a carnivore diet can and has helped hypothyroidism, particularly Hashimoto's thyroiditis, which is quite common. And so it's worth trying. Give it, what I tell people, give it about 3 months and see how you do. Now, there may be some other things you have to do, and you might have to supplement, the thyroid hormone while you're resolving those symptoms. Remember, don't make clinical diagnoses on lab values alone. There needs to be clinical signs and symptoms that corroborate those laboratory values, because it could just be a matter of sensitivity, right? Same thing goes for androgens or anything else. So anyway, hopefully that helps. You guys take care.